So level 4 gives you a very particular set of skills, and probably the backbone of it is assessment. And it's absolutely essential, isn't it? When somebody comes into your clinic with lower back pain or overuse injury of the calves, or between the shoulder blades pain, that we have a very clear set of skills of how we assess that person. And the most important bit for me around level 4 is that relationship between antagonists and synergists. So we understand that muscles get over dominant, create a postural change, and then it's about, well, okay, we can see that, we might be able to assess it, then what do we do about it? Now level 4 gives you some hand skills, 2 or 3. The most important one probably for me would be muscle energy technique, MET. There's 2 or 3 different types of MET that come into the evening, come into that course. We'll go into in some detail. MET is a really important way of lengthening muscles. And it's a very simple procedure, and probably the hardest bit of it is about positioning of the client. How do you put the client to perform the muscle energy technique that you wish to? So you learn MET. Soft tissue release, STR, is a locking and lengthening technique. It's a hand skill that is again designed and worked to lengthen muscles, to get range of movement better. So therefore, if you get muscles at the right length, then the posture can be regained and normality can come back into the system. Trigger point therapy, we touch a little bit in level 3. In level 4 it becomes a really important part of the course. Key bit about trigger pointing is the referring pain. So you get pain, a nice example is the scalenes in the neck, muscles that run from the ribs up into the back of the neck. They rotate the head the opposite way. If they get congested and tight, we have an anterior pull on our necks, which, if the nervous system that runs through the scalenes, we can have pins and needling in our arms, we can have numbness in our wrists. So the referring is crucial, and the danger for us is, well, I'm going to rub your arm and your wrist and your forearm, where in fact the reason for that referred pain is through the scalenes and sternocleidomastoid in the neck. So trigger point work is really essential, and there's a couple of different types of trigger point work. I like a lot of massage to be with movement, and I tend to incorporate trigger point work with movement, and I get some great results with putting people in a seated position or sideline or laying prone or supine and getting these techniques really off the ground. So that's the backbone of what level 4 is about.